I'm talking about proximal supraventricular tachycardia, or for short, PSVT. Here's a little video just to get you started, just explaining PSVT.
Your heart is a muscular organ which lies in the center of your chest. Your heartbeat is controlled by electrical impulses, which travel across the heart, making it contract. The atria contract first, sending blood into the ventricles. The ventricles then contract, sending blood to the lungs and around the body. Nerves supplying the heart change the rate at which impulses are sent across the heart muscle to meet the needs of the body. In supraventricular tachycardia, or SVT, the irregular electrical impulses pass across the ventricles and back up into the atria in a circle, rather than traveling from the atria to the ventricles in one direction as they should. This makes the heart beat faster.
So, like I said about my last slide, PSVT is an arrhythmia. It is an abnormal heartbeat. It starts off with electrical impulses from the sinus node, just sending off in the atrium, which this would be considered a normal heartbeat. This is what everyone should have. But with people with PSVT, they have multiple electrical impulses firing in different places. It could be anywhere in the heart. When they fire at the same time, it causes it to speed around in the heart like a circle. And this will cause the heart chambers to start contracting, which will make the heart beat really, really fast. And that is not good for your heart. If you see right here, this is what a normal heartbeat should look like. But a person with PSVT, do you see how their heart keeps spiking up? This is not good for them. And all of these, like the electrical impulses keep sending and going in the circle and their heart contracting, this is unpredictable. They never know when this is going to happen, and it can happen to them anytime. So who discovered PSVT? Who helped discover PSVT? Well, these three doctors really attributed to the discovery and findings of anything about PSVT and almost anything about arrhythmias. Dr. Alfred Pick, Dr. Louis Kultz, and Dr. Richard Langendorf. Dr. Alfred Pick, he's a member of the Cardiological Society of Peru. He is also on the American Heart Journal and the Journal of Electrocardiology. He came to America for something better, because Dr. Alfred Pick and Richard Langendorf were both Germans. They were both from Germany, born and raised. And during this time of them trying to do studies on arrhythmias and the heart, World War II was going on, so it really wasn't a good time for them. So they came to America for something better. But Dr. Louis Kultz actually accepted Dr. Richard Langendorf's visa because they all wanted to work together. Dr. Louis Kultz is an American doctor. That's how he accepted the visa. But they all worked together at Michael Reese Hospital after they all got accepted to America and they all started. When it was discovered, when was PSVT discovered? Well, it was discovered around 1940 through 1955. I know this isn't a specific date. This isn't a time where someone said, this is what PSVT is. But a lot of things had to be discovered to know what PSVT is. First, an arrhythmia had to be discovered because PSVT is an arrhythmia. It's just a certain type. Then the type of arrhythmia had to be discovered. And then what affects the arrhythmia had to be discovered, which then led to the discovery of PSVT. So this took a long time to find out. PSVT, it was being discovered during the World War II time. So the diagnosis of PSVT when it was first diagnosed was the end of World War II. Okay, so how was PSVT discovered? How it was discovered? Again, the doctors that discovered it were Dr. Pick, Dr. Langendorf, and Dr. Katz. They came up with 60 theories on arrhythmias to find PSVT. Along the way, they also found fibrillation. They studied thousands of EKGs of arrhythmias. They also found The AV node pathways, they found how it affects PSVT and what pathways the electrical signals are going in. And their mechanism led them to find many other types of arrhythmias. Just for fun, who has PSVT or who had PSVT? Well, this is Tony Blair, the former Prime Minister of England. He was diagnosed with PSVT in 2003. And as soon as he was diagnosed, again in 2003, he got the cure treatment, which is a catheter ablation. He's never had PSVT since and never had a heart problem since. So how do you get PSVT? How do you avoid getting PSVT? PSVT isn't something you really get. It's not something you can contract from others, and that's not something that you could really get from drinking something or eating something. You have to be born with PSVT. It is actually genetic. So there are certain things that do trigger someone's PSVT. Something like coffee, stress, smoking, drinking, taking different medications that just affect their PSVT differently. This can give them episodes where their heart just beats really fast. It can do nothing to them. All people are different. PSVT starts showing signs in like the late 40s, early 50s. So you can grow up all your life not even knowing you've had PSVT. And that's how it was for my grandma. She grew up all of her life not knowing she had it. In her early 50s, she showed signs of PSVT, and that's when she was diagnosed. They actually found that twice as many women have it as men. So it's more common for women to have it than it is a man to have it. And again, all people react differently to different things, so almost anything can trigger PSVT. So how does PSVT affect people? And the effects are pretty bad. It could cause a stroke, a heart attack, but it can also be very minor. And it's something you really need to watch out for if you do have PSVT, because again, anything can trigger it. It gives you painful chest pains. It can make you faint. It gives you lightheadedness, dizziness, gives you low energy, anxiety, sudden fatigue, shortness of breath, and it also gives you palpitations. And it's a sense of feeling your own heart rate beat in your chest, which is probably terrible. How do doctors diagnose PSVT? Okay, well, doctors misdiagnose PSVT every day for a common panic attack because it does show the same signs and symptoms as a common panic attack, but it's much more serious. PSVT has their hearts beating at a fast rate, which could kill someone. This is dangerous to anyone that has PSVT. The doctors can't diagnose PSVT unless they see how fast the patient's heart is actually beating, so they need evidence. For them to get this evidence, they can have a patient wear a Holter monitor right here. It is a portable ECG. You would wear it for 1 to 7 days, and it just monitors your heart and tracks anything abnormal. Another one they can wear is an event monitor right there. It is something a patient would wear for 1 to 2 months. Another portable ECG, and it will say or tell the doctors any arrhythmias the patient is having or had. And another one is an implantable monitor. This is something that would be implanted under the skin by the doctor, and it only works for several days, but it will show any arrhythmias or anything that takes place in your heart. But the ultimate test is an electrophysiographical, so it's like an EP study. It diagnoses the condition and tells the doctor what's really going on, the precise place where this heart is having trouble. That's what doctors use the most. Can we avoid PSVT? Well, we already know it's genetic, so for you and those of you who don't have it, okay, you're fine. You don't need to avoid PSVT. But for those of you that have PSVT, because it was genetic, here are some tips that you can use to avoid an episode. Because there's no avoiding PSVT, but there's avoiding some episodes. Maybe it might get better. No drinking, no smoking, no drinking caffeine. Make sure you're not stressed. Don't exercise as much, which I understand this is maybe not the way some people want to live. Just get a reversible surgery. Just reverse the PSVT. Get a cure surgery. It's possible. Shout out to my last slide. Is PSVT curable? Yes, it is. But you can take medications. You'd have to take these medications for a lifetime because you can't just, it's not something you can take and then stop and it be cured. You're going to have to take these for a lifetime if you have PSVT and you don't want it anymore. And again, this could help some people, this could hurt some people, this could affect them, this could not. Like, they could still have PSVT taking this medication. So that's why there's other options. There's also a Valspa rub. And it's like a rubbing on the carotid artery. So you just massage the artery. Sometimes it makes the heart calm down, but it doesn't stop an episode from happening. It just calms the heart down. Or there's a catheter ablation. And honestly, this is the cure to PSVT. If you want your heart to be fixed, let the doctors go in and fix it because they can. What are the warning signs of PSVT? Well, there's neck aches, rapid pulse, dizziness, migraines, chest pains, sweating. Everything that was the effects of PSVT, what one would experience during an episode, is basically the warning signs. There's no real way to know that you have it until you have an episode, which is really scary, but again, PSVT can be cured. If we catch PSVT early enough, does it affect people as much? It's kind of tricky because you can't really know that you have PSVT until you have an episode. That's the only real proof that you have it. So that's already going to take damage and toll to your heart. And a lot of people don't get cured until late 40s, early 50s. That's when PSVT starts to show. And being older means that you can't bounce back as fast as a younger person because you're not young enough to heal as fast. So PSVT is always going to affect someone and always going to take a toll on someone. But if you catch it when you're in your late 40s and early 50s, I guess it is better to catch it than when you're in your 70s and 80s. It's better for your body. But at the same time, it's still going to take a toll on your heart either way. Explaining the cure. Well, we know the cure is the catheter ablation. And it uses an electrode to stimulate the heart. This makes the heart have an episode of PSVT. So this tells and shows the doctors where exactly the heart is misfiring and what the heart is doing. When the doctors know that, they can then proceed to use a rod to go up someone's leg to get to their heart. As soon as they get to their heart, they can use radio frequencies to kill the problem areas. And this is how you cure PSVT. Thank you guys so much for listening to my presentation about PSVT. This is where I found all my information, and these are my question answers. I personally went up to my grandma who had PSVT and asked her questions about it and how it affected her life. It's really crazy how it actually affects one's life and everyone else around them. Her name is Deborah DeVault, and her information's down at the question answer sheet. So if you have any questions, just ask.